I'm here with Anthony Cataldo, CEO of GT Biopharma.
Yes.
Anthony, thank you for being here.
All right, thank you.
I'd love to know your opinion on the future of biotech for the next 5 years.
You know, we're actually playing part of that future. Our company has a next generation technology. Everyone talks about targeted immunotherapy has been a really popular buzz phrase. And it's really starting to take hold now because we've advanced so far on what we can do with cancer cells and with your immune system. So in biotech, we're a NASDAQ company. In that sphere, biotech is really the hot sector of NASDAQ. The hottest sector of biotech is NK cell technology, which is what we are. So we're often, we're kind of on what I call the bleeding edge. And I always, I get a lot of interviews now because my previous company, a company called Iovance, I started it got up to 7 billion, so I was that guy that went from idiot to genius overnight. But I really wanted to go further with targeted immunotherapy because cell therapy works, but it's $1 million to $2 million per patient. And there's a lot, and in the ergonomics, it's tough on the patient stuff. I wanted to do something more off the shelf and more wide reaching because growing up poor in a projects in Cleveland, Ohio, not everybody's got insurance. And so we found a way to leverage NK cells, which are the most prolific cancer killers, and target direct them. And we're on patient number 11 now in our phase 1 clinical trial. And most importantly on that, it's what's going on with the patient that counts. I tell folks that I think CEOs talk too much, and I really don't think you should listen to us because in biotech, it's all about clinical trial data, and our data has been stellar, hence the 600% growth since we uplisted to NASDAQ in February. And it's all being driven by the data, and I get out and try to tell the story and try to make sure. So it's all about the immune system now, and we've come a long, long way. Cancer is really smart too, and cancer is, it's a terrible disease, but it's to be respected. And from a biological perspective, it's very elegant. It sends false signals into your immune system to trick it to think that it's not a foreign invader, and it works for a while. And oftentimes, by the time a patient realizes they're in stage 4, your immune system realizes it too, but you're in big trouble then. So our technology has been able to handle the worst of the worst patients that everybody's given up on, and it looks like we'll move into earlier stage patients as well. So that's a long-winded answer for the question.
Well, sign of hope for people. I'm looking forward to seeing what happens with the technology.
Yes, again, I reiterate, it's all about the data.
Anthony Cataldo, thank you for being here.
Yeah, great.